Next is step 3, the critical appraisal of evidence. So for my critical appraisals, I used Johns Hopkins Nursing Evidence-Based Practice Appendix G to summarize the individual evidence that I chose for this presentation. Now, the first article was a prospective randomized double-blind controlled trial of acetaminophen and diphenhydramine pre-transfusion medication versus placebo for the prevention of transfusion reactions. And this study was done in 2008. This RCT was done on a hematology-oncology floor that had a sample size of 315 patients. The study was done to prospectively compare the risk of transfusion reactions in hematology-oncology patients who received the combination of acetaminophen and diphenhydramine versus a placebo before a blood transfusion. I used Melnick and Feinholt-Overholt's critical appraisal tool to comprehensively answer all the questions from the article, and therefore the quality of the study was high due to internal validity. There were limitations in this study, such as plasma transfusions were not included, and no studies were also excluded, even if they were administered off-site. And then my second article was entitled Transfusion Premedication to Prevent Acute Transfusion Reactions, a retrospective observational study to assess current practices. This study was published in 2010. The study was done because the use of premedication to prevent acute transfusion reactions was reported to occur in as much as 50 to 80% of blood transfusions. But there has been few clinical studies that have been performed to assess if this is true of current practice. So an observational retrospective chart review on a stratified random sample of 324 patient transfusions that took place over a 6-month period at 3 different acute care hospital sites were done. Through Melnick and Feinholt-Overholt critical appraisal tool, I was able to also comprehensively answer all the questions from the article, and therefore the quality of the study was high also due to internal validity. Though there were also limitations to this study, with about 66 out of 324 chart reviews excluded for various reasons, which is a large portion of the patient sample.